A couple days after returning from a trip at the beginning of March, Lisa Smith felt like she had the flu.
And then all of a sudden, like a freight train, it rolled back and totally ran over me.
She was exhausted, had fevers, loss of appetite,
I was able to get in to see the physician.
but no cough.
They took you in through the back door, and the exam room was immediately as you entered. So I, as being a suspect COVID patient, didn't traipse through the entire practice.
And got tested for the flu, which was negative.
I think this was at the very beginning when many people were being tested.
And then COVID-19.
Labs were very backed up.
It would be 11 days before she learned the results of the COVID-19 test, and she wouldn't learn those results from home.
My fever hit 106, and I was on the phone with my niece who's a nurse, and she said, "I don't care. I'm sending an ambulance for you right now."
She was taken to Maine Medical Center where she stayed for 5 days.
The care was just extraordinary. They were very prepared.
And that's where she learned the results from her first test for coronavirus. They were negative. Another test taken at the hospital returned results faster, and she did test positive. She was prescribed hydroxychloroquine, a drug used to prevent or treat malaria. It's being studied as a possible treatment for COVID-19.
I'm just one person. I don't know. It may not work for everybody, but I felt like it worked for me.
Smith is now fully recovered and back to spending time with her husband, dogs, and rooster. Feeling fortunate, she took the situation seriously from the beginning, staying home to avoid the spread of COVID-19.
And didn't have a false sense of security.
So, some important things to note from Lisa's story. She did not have all of the symptoms of coronavirus, only a few of them. She contracted the virus, excuse me, sometime early in March and went through the testing process in its very early stages. And the state has been making efforts to streamline that process since. And she is donating her plasma. That is part of efforts to use the plasma from recovered COVID patients to help others recover.